Hackers Toiec Listening Vocabulary. Allergist.
Allergist.
I have to see an allergist for my runny nose. Bandage.
Bandage. He's wearing a bandage on his leg.
Be allergic to.
Be allergic to.
I'm allergic to fish. Be in good shape.
Be in good shape. He seems to be in good shape.
Blood pressure.
Blood pressure.
She's getting her blood pressure checked. Blurry.
Blurry. My eyesight is a little blurry today.
Cancer.
Cancer.
Lung cancer is common among smokers. Cavity.
Cavity. My dentist filled a tooth with a cavity.
Check out.
Check out.
You need to have your bag checked out. Check up.
Check up. I'm here to get a general checkup.
Chest.
Chest.
I've had chest pain lately. Cholesterol level.
Cholesterol level. My father worries about his cholesterol level.
Despair.
Despair.
He despaired at having no cure for his ailment. Disturbing.
Disturbing. It is disturbing to see mentally ill patients.
Earache.
Earache.
He has been suffering from an earache for a long time. Emergency room.
Emergency room. The emergency room has many patients.
Examine.
Examine.
The doctor is examining the patient. Expose.
Expose. The patient was reminded not to expose the wound.
Eye doctor.
Eye doctor.
The eye doctor gave me a thorough eye exam. Eye exam.
Eye exam. The eye exam proved he had perfect eyesight.
Fat.
Fat.
The patient was told to lower his body fat. Fill the prescription.
Fill the prescription. The pharmacist will fill your prescription.
Filling.
Filling.
The dentist put a filling in 3 of her molars. First aid.
First aid. They are trained to give first aid in an emergency.
Fitness.
Fitness.
She passed a test for physical fitness. Flaky.
Flaky. Dry, flaky skin is a common skin problem.
Germ.
Germ.
The hospital uses bleach to kill germs. Go on a diet.
Go on a diet. He advised me to go on a diet.
Hay fever.
Hay fever.
She suffers from hay fever every spring. Health certificate.
Health certificate. Can I get a copy of the health certificate?
Hearing.
Hearing.
Prolonged exposure to loud noise can cause hearing loss. Heart disease.
Heart disease. He was diagnosed with mild heart disease.
Hold a blood drive.
Hold a blood drive.
The hospital holds an annual blood drive. Hygiene.
Hygiene. The nurses are particular about hygiene.
Immune system.
Immune system.
His sickness resulted in a weaker immune system. Infection.
Infection. After the operation, he had a serious infection.
Injection.
Injection.
The nurse is giving the patient an injection. Injury.
Injury. When did you get that arm injury?
Insomnia.
Insomnia.
Too much caffeine can cause insomnia. Invalid.
Invalid. The nursing home takes care of invalids.
Massage therapist.
Massage therapist.
She sees a massage therapist to reduce stress. Measles.
Measles. She caught measles when she was 3 years old.
Medical.
Medical.
The medical study was published in a journal. Medical report.
Medical report. The doctor carefully read the medical report.
Medicine.
Medicine.
You should buy some medicine for that cold. Mumps.
Mumps. She could not swallow solid food because she had mumps.
Nursing.
Nursing.
She is the director of nursing at the hospital. Nutrition.
Nutrition. The school meal planner specializes in nutrition.
Nutritious.
Nutritious.
Hospital meals are designed to be nutritious. Optician.
Optician. She visited an optician to have her eyes checked.
Orthopedic.
Orthopedic.
He had his spine checked by an orthopedic specialist. Outpatient.
Outpatient. As an outpatient, she visits the hospital regularly.
Patient's record.
Patient's record.
The doctor is reviewing the patient's record. Periodically.
Periodically. You need to visit your dentist periodically.
Pharmacy.
Pharmacy.
She buys all her medicine at the corner pharmacy. Physical examination.
Physical examination. He underwent a thorough physical examination.
Physical therapy.
Physical therapy.
He needed physical therapy to rehabilitate his injured knee. Physician.
Physician. Sarah saw a family physician for her headaches.
Pill.
Pill.
Take these pills 3 times a day. Positive.
Positive. This patient's blood type is A positive.
Practice.
Practice.
The doctor is opening up his own practice. Prescribe.
Prescribe. The doctor prescribed a strong pain reliever.
Psychological.
Psychological.
The patient had to take a psychological exam. Recover.
Recover. He spent a few days in the hospital to recover from the flu.
Recuperate.
Recuperate.
She stayed home to recuperate from her illness. Relinquish.
Relinquish. The doctor was forced to relinquish his license.
Risk.
Risk.
Drinking increases the risk of liver problems. Runny.
Runny. He has a runny nose because of a cold.
See.
See.
The doctor will see the patient now. Self-defense.
Self-defense. Sufficient sleep is the best self-defense against sickness.
Sneezing.
Sneezing.
One symptom of his allergy is sneezing. Sore.
Sore. His sore throat bothered him when he talked.
Sports injuries.
Sports injuries.
Athletes are prone to different kinds of sports injuries. Sprain.
Sprain. He sprained his ankle while playing basketball.
Spread.
Spread.
The spread of the infection could not be controlled. Sterilize.
Sterilize. Medical implements are sterilized after every use.
Surgery.
Surgery.
They scheduled surgery when his appendix burst. Surgical.
Surgical. His herniated disc required surgical treatment.
Surgical instrument.
Surgical instrument.
The surgical instruments were laid out on the table. Take one's temperature.
Take one's temperature. Let me take your temperature first.
Take some medicine.
Take some medicine.
He took some medicine for his fever. Temperature.
Temperature. Although he felt sick, his temperature was normal.
Toothache.
Toothache.
She took an aspirin to relieve her toothache. Toothpaste.
Toothpaste. They prefer a sodium-based toothpaste.
Treat.
Treat.
He was treated for an irregular heartbeat. Tuberculosis.
Tuberculosis. She had a stubborn case of tuberculosis.
Vaccination.
Vaccination.
The residents had vaccinations against smallpox. Veterinarian.
Veterinarian. The veterinarian treated a cat for an injured paw.
Vision.
Vision.
The girl being tested has 20/20 vision. Waiting room.
Waiting room. She was in the waiting room for half an hour.
Ward.
Ward.
The patient is in the emergency ward. Well-balanced.
Well-balanced. The man was put on a well-balanced diet.
Wheelchair.
Wheelchair.
The woman is pushing the wheelchair. Aircraft.
Aircraft.
The passengers are boarding the aircraft. Baggage claims office.
Baggage claims office. Lost luggage should be reported to the baggage claims office.
Book.
Book.
You should book tickets at least 1 week in advance. Cabin.
Cabin. The pilots are seated in the cabin.
Captain.
Captain.
The captain made an announcement over the intercom. Carousel.
Carousel. She's pulling a baggage from the carousel.
Check-in.
Check-in.
The passengers going to Tokyo were told to check in. Check-out.
Check out. They checked out of the hotel after lunch.
Check-in counter.
Check-in counter.
Many people are lined up at the check-in counter. Clerk.
Clerk. The hotel clerk presented the guest with his bill.
Crew.
Crew.
The ground crew is checking the plane. Customs.
Customs. The passengers had their bags checked at customs.
Customs officer.
Customs officer.
A customs officer questioned a woman about her bag. Depart.
Depart. The flight will depart in 20 minutes.
Departure.
Departure.
The departure was delayed because of the weather. Fasten the seatbelt.
Fasten the seatbelt. Please fasten your seatbelts for takeoff.
Flight attendant.
Flight attendant.
A passenger asked the flight attendant for a blanket. Fly back.
Fly back. He is expected to fly back the same day.
Fly in.
Fly in.
The group is flying in tomorrow. Fold away.
Fold away. The passengers were reminded to fold away their trays.
Front desk.
Front desk.
The guest went to the front desk to inquire about transportation. Gate.
Gate. The passengers are being directed to the gate at the right.
Housekeeping.
Housekeeping.
The woman in white is in charge of housekeeping. Inspect.
Inspect. The customs officer is inspecting a large box.
International flight.
International flight.
This international flight is expected to take 10 hours. Land.
Land.
The captain is preparing to land the plane.
Lobby.
Lobby. The customer is waiting for you at the lobby.
Luggage.
Luggage.
The luggage was placed on the wrong flight. Maid.
Maid. The maid is cleaning the hotel room.
Non-stop flight.
Non-stop flight.
They have taken a non-stop flight to Guam. On board.
On board. Is there a doctor or nurse on board?
Overhead compartment.
Overhead compartment.
He put a carry-on bag in the overhead compartment. Package.
Package. The goods were packaged securely.
Passport.
Passport.
She went to the embassy to renew her passport. Pilot.
Pilot. The pilot is putting the airplane on automatic mode.
Reserve.
Reserve.
She's reserving a table at the hotel restaurant. Return flight.
Return flight. The return flight took longer than the flight coming in.
Room service.
Room service.
He called room service for a midnight snack. Seatbelt light.
Seatbelt light. Please do not get up until the seatbelt light is turned off.
Single.
Single.
Can I reserve a single for next weekend? Take one's bag off.
Take one's bag off. He took his bag off the conveyor belt.
Take off.
Take off.
The plane's takeoff went smoothly. Terminal.
Terminal. He waited 3 hours at the terminal for a delayed flight.
Unpack.
Unpack.
They're unpacking their luggage in the room. Via.
Via. She's going to Hawaii via Southeast Airlines.
Visa.
Visa.
She was granted a 2-week visa for Japan. Visa extension.
Visa extension. They visited the embassy to get a visa extension.
Act.
Act.
A woman is acting in a play. Applaud.
Applaud. The crowd is applauding the show.
Audience.
Audience.
There are people in the audience standing up. Auditorium.
Auditorium. The auditorium is now empty.
Award.
Award.
The girl is receiving an award from her teacher. Balloon.
Balloon. The man is giving a small boy a balloon.
Banquet hall.
Banquet hall.
People are streaming into the banquet hall. Clap.
Clap. The fans are clapping for the team.
Costume.
Costume.
The girl is wearing a witch's costume. Crowd.
Crowd. A crowd is filling the large hall.
Dress code.
Dress code.
A dress code must be followed at work. Exhibit.
Exhibit. There are paintings and statues in the exhibit.
Exit.
Exit.
The man is looking for the exit. Fare.
Fare. The man is putting a coin in the box to pay for his fare.
Film.
Film.
The film is being shown to a test audience. Go on.
Go on. There is a variety of entertainment going on at the circus.
Museum.
Museum.
The museum is having an exhibit of Egyptian artifacts. Occupy.
Occupy. The phone booths at the park were all occupied.
Participant.
Participant.
A welcome speech was given to participants of the seminar. Put the poster.
Put the poster. A man is putting the poster on a bulletin board.
Remain empty.
Remain empty.
Very few seats in the stadium remain empty. Spectator.
Spectator. Some of the spectators are standing on their feet.
Square.
Square.
A man is playing the violin in a square. Take one's seat.
Take one's seat. The woman is taking a seat in the theater.
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 An orchestra is playing music in the theater. Trade show.
Trade show. The trade show will be held next week.